Tumors from the stomach, from the pancreas, from the liver, from the ovaries sometimes can spill over or spread into the peritoneum, and it's a secondary peritoneal cancer. This is usually a fairly advanced stage of the cancer. Now, when we look at tumors that spread within or along the peritoneum, one of them, what we call as primary peritoneal cancers, necessitating chemotherapy first, and then good responders actually undergo a very extensive surgery. There are other forms of peritoneal cancers called pseudomyxoma peritoni, usually rare cancers, sometimes usually originating from the appendix. It has jelly-like material which is spread all along the peritoneum and along the surface of various organs. The treatment for these kind of tumors, called pseudomyxoma peritoni, is an extensive surgery where we remove the entire peritoneum, debulk these tumors completely, and once the entire disease is cleared, then we give what is known as HIPEC, that's intraperitoneal chemotherapy. At a higher temperature, chemotherapy drugs are given inside the abdomen. These tumors are not particularly responsive to IV chemo, and that's why these tumors respond better to intraperitoneal chemotherapy. So these are tumors that, when treated correctly, have reasonably good outcomes. Then the other subset is where surgery actually is involved, is patients with colorectal cancers with peritoneal disease. Again, it's multimodality treatment. We have to involve the medical oncologist, the radiation oncologist, plan out the treatment very accurately, along with the surgeon, the surgical oncologist. Sometimes in certain tumors may or may not benefit with HIPEC, but they will definitely benefit with a cytoreduction. That means removal of the entire peritoneum. So these are a very, very niche type of tumors requiring a lot of specialty inputs. It requires a lot of expertise. Not everyone specializes in dealing with these cancers. And when a specialist unit treats these patients, the outcomes are way, way better than generalists treating these patients. So I think that's an important message. Some of these peritoneal cancers are the end of the road, especially when it arises from organs like the stomach or the pancreas. But in certain tumors arising from the appendix or directly from the peritoneum, sometimes from the ovary, these are the patients who are likely to do better with a combination of chemotherapy and aggressive surgery and intraperitoneal chemotherapy. So I think that's just in a nutshell about peritoneal cancers. Thank you.